So today we are in Oakbrook doing training with the techs for the exercises. We're going to start with level 1 exercises, and there are 5 of them. What are they, guys? First one is?
Bracing.
Bracing. Second one?
Marching.
Marching. Third one?
Alternating leg press.
Alternating leg press, ALP, right? Fourth one?
Bridging.
Bridging. Last one?
Wall squat.
Wall squats. Okay, so those are the ones that we're going to do right now. So let's talk about the method by which we teach this to patients. So there's a couple things that you should just keep in mind. Number one is the patient position. What position are they supposed to be in or start in? Number two is you as a tech, where should you be positioned so that you're having the best luck with them, teaching them. Number three is the manual contact. What should you be pressing on and touching in order to facilitate the right movement? Fourth thing is the verbal command. What are you telling the patient? And then the fifth thing is, if they're doing it correctly, how do you know they're doing it correctly? If they're not, what can you do to facilitate the correction? Okay? So the first thing we're going to do right now is called bracing. So we're going to have her patient position, start with the knees bent up, like so. What we're looking at is these two bones here, the ASIS, anterior superior iliac spine, which are also these two bones right here on George, our lovely skeleton. When somebody tightens their stomach, those muscles, those bone parts are not supposed to move anywhere. We'll get to that a little bit more in a minute. So patient position is right here. Therapist position, if the patient's on the floor, just kneel down. You don't want to stand over them and be doing this because that's really bad mechanics for yourself, as well as it just looks odd, especially for a place that talks about body mechanics a lot. Second thing is, if they're up on a table, just get it to the height that you feel comfortable. All right, so we've got patient position, tech position. Next is manual contacts. What are we trying to do with abdominal bracing? What's the purpose of it? The purpose of it is to get the core to activate, right? So if I want to use my hands to help facilitate that, I'm not just going to tell them my verbal command of, hey, squeeze your abs, or hey, do a core bracing, or hey, can you just suck everything in? Because those are not the correct ways that we want to do that. So our manual cueing is going to be, how can we make this whole area firm from where the ribs at the bottom have muscle attachments all the way down to the pubic bone, which is right here, and the ASIS. So this whole thing that's flat on top is musculature, but those muscles also wrap around to the backside, okay? So our manual contact could be all the way around like so, or it could just be right here. We'll get to that and what's appropriate for facilitation when we see how she does it. Then the verbal command is not suck it in, not do a brace, not all of those things. When we're teaching them how to do a brace, we need to instruct them in the how, right? So the how is make it so that your stomach is like a corset, or you can command them to make your stomach firm so that I can't push my fingers into your stomach, or make your whole trunk like a wall that's very strong so that I can't penetrate that wall with my fingers, okay? So that's how we would do this exercise. Let's see now how she performs it. Unless you've got someone who's shy with their belly, you really do want to actually see the muscle contraction. So we never pull up somebody's clothing because that is very inappropriate to undress your patients. What you want to do is have them expose their belly. So you ask them, patient, is it all right if you pull that up so I can see your muscles? She says yes, great. And then pull it down just a little bit so we can see the lower abdomen as well. Perfect. So now we have an abdomen that's exposed. So if she does this, and I ask her to, don't let me put my fingers into your stomach, what does she do? She actually does it really, really nicely. Come on over to the side so you guys can see this. She makes a nice contraction without tucking her buns under. What do most patients do if they've been to other clinics or they've been to Pilates? What do? They squeeze their butt, and it looks like what? Yeah, they squeeze here. So they've got a contraction, but they don't have anything happening here. Or if they have a little bit happening here, what you've noticed is that they aren't bracing anymore. They created this tilt, right? And so we would call that a posterior pelvic tilt, not what we want, okay? So we relax everything. What else do people do? They suck in. So if they're thinking about a stomach contraction, do a stomach contraction, then suck everything
suck it in?
Yeah, suck it in. They do it like that. And you're like, well, wow, that's nice and firm. They must be doing that right. But really what you had noticed now, do it even more aggressively, is she has taken out the front part of her wall. So her wall that was supposed to be here has now shrunk down to here. So her rib cage, if she is upright, has no place to rest. So we don't want her to do it that way either. So if we say squeeze again, Good, make everything firm. She does a really, really nice job of not flattening her back down, of not posteriorly tilting, of not arching, of not using her buns or anything else. The only thing she does is she takes these muscles here and squeezes them together. That's what we're looking for this exercise.